guys, it's Khaki. This video is going to be a little longer than my norm. This is my 6-month video. I had gastric bypass 6 months ago last week, and I just want to tell you about some things that I have learned and things that I've done since I had gastric bypass. Kind of talk about my life as a post op and some insights that I have discovered. Just first off, let me tell you my stats. I am 50 years old. I am 5'0". I have lost 92 pounds since the start of my weight loss journey. And as far as measurements, I love to look at this. I have lost 12.25 inches from my hips, 5.5 inches from each thigh, and 12.10 inches from my waist. I've also lost an inch from each arm, but as I've told you before in previous videos, my arms are my nemesis. When I get to a weight that I'm comfortable at, that's definitely something I'm going to be looking into as an arm lift. So, anyway, don't know if I have talked before about I know I did a video about what led me to seek out gastric bypass, but I don't know that I've talked about myself much. Um, I am a doctorally educated nurse practitioner in a independent private practice, and I've done this for many years. That does not make me an expert in weight loss surgery at all. I am in family practice, and over the course of the past few years, I have referred probably 100 patients for weight loss surgery and have followed up with those people after weight loss surgery. And this doesn't make me any smarter than your average bear, but it has given me insight in my patients who do well after gastric bypass and who fight off, regain, and maintain that healthier weight, and some of those who struggle. So I feel like that has given me personally some really good tools and knowledge in my own journey. And I am so thankful to all of those people who have shared their journey with me. Now, this is not a healthcare video. This is not medical advice by any means. If you have any medical questions, please ask your surgeon, your surgical team, your PCP. And if I am your PCP, which I do have some of my patients watching, if you have any questions, come in and see me or call. But anyway, so these are some things that I have learned that I hope helps other people. Please take before pictures and also document things along your journey. Take measurements. Those things are going to be invaluable, and you are going to be so glad you did. As obese folks, I know and I feel like a lot of us avoid taking pictures because of shame. We just don't want to see ourselves. That reality is not a good place for us. So it's kind of out of the norm for us to take pictures, but please take pictures, take measurements. One day you will be so glad that you did. The other thing that I highly encourage you to do is create a safe space for yourself in your home, in your area of your workplace. Please, if you share your home with another adult, ask them to respect your space. Put those things that are triggers for you somewhere that they're not easily accessible to you. Put them in a cabinet that's just for them so that every time that you are passing by that, you're not tempted. It's not, for lack of a better word, rubbing your nose in something that's going to set off behaviors that you really don't want. If you share your home with children, you're in control. Those kids don't need that junk any more than you do or you did. I have been very fortunate in that my husband supports me so much in my journey. He has never had a weight problem, so he can pretty much have anything he wants. But I have noticed in myself that if I buy something, even that's not off limits, something like nuts, pork rinds, something like that, if it's there and it's out, I'll eat it. You can't eat what you don't have. So if trigger foods for you are chips, cookies, donuts, whatever, why are they in your house? Please be kind to yourself. Your home should be your sanctuary. And if you work with people who bring things like that to work, or if you're like me and you work in a field where people bring things like that to you, send it home with a coworker. Don't keep it around to torment you, because then you'll focus on what you can't have instead of where you should be focusing, and that's what you can have. Um, Another thing, advocate for yourself. When you're talking to friends and you're going out to eat, don't just go with the flow of everybody. If people are like, "Where do you want to go?" And you're like, "Oh, it doesn't matter," and you end up somewhere that just serves pizza, and there's not a choice that you feel comfortable with that fits into your current plan. Or if you end up at a bakery, that's not good for you. Speak up. Speak up. When I went on my recent trip, I didn't want to be that friend that was like, "Oh, I can't eat there. I can't eat here." But I did say, as long as they have salads or a protein and vegetables, I'm good. That pretty much included everywhere except places that just serve pizza or things like that. So I really encourage you to learn to speak up and to be your own advocate. Another thing, uncomfortable topic for a lot of people, but the vast majority of weight loss patients struggle with constipation. You would think because of either the removal with the sleeve of 80% of your stomach or with the bypass, the rerouting of most of your intestines, that it's going to be the opposite, that you're going to have diarrhea. That has not been the case with hardly anybody I have talked to or myself. So plan on it. Just start from the beginning, taking a daily stool softener or Miralax or something like that. You may find that that does not work and that you have to step it up a little bit and go to something prescription. If you see that's happening, speak up. Talk to your healthcare provider. Don't let it get bad. I have known many people and have had many patients who ended up in the hospital due to constipation. I know that's hard to believe, but it can cause permanent damage. It can cause necrosis to your bowels. So just stay on top of it. Expect it, anticipate it, plan for it, and stay on top of it. Another thing you need to expect and anticipate is hair loss. For the vast majority of us, it's going to happen. I took all my supplements. I got in adequate protein, and I've had a lot of hair loss. It's pretty significant. One thing that, it's starting to come back. I see new hair. I found for me about that 4 to 5 month area was the worst. One thing that I have found that has really helped me, and I'm going to insert a picture of it. It is a powder. It's like a thickening tinted powder. There was a point at around that 5 month area that I could actually see my scalp pretty well, and that was scary. And I was very self-conscious of it. This powder, just a little small amount, covered that up so that I wasn't so self-conscious of it. It made my hair feel thicker. It's a band-aid. The hair will grow back. Just know it. Things like biotin, other supplements may help your hair grow back stronger, but they're not going to prevent hair loss. And they may interfere with some of your medicines. There is actually a warning about biotin and thyroid medicine, and it can actually cause your thyroid testing to be inaccurate or be off. So just keep that in mind. It's going to happen, most likely, unless you're one of those very lucky people. Have the tools you need to prepare for it and just roll with the flow. It will come back. Something else that in talking to patients has really come up. You can't just change the amount of what you eat. In those immediate months after weight loss surgery, you are going to eat less. It's physical. You have a smaller stomach. You are going to eat less. But one thing that I think so many people make a mistake of is eating the same junk that got us into the situation where we needed weight loss surgery and just think, I can only eat so a little bit. Come on. It's not a big deal. I used to, if I eat a hamburger with a bun and mayonnaise and all French fries, I can only eat a little bit. So, what's the big deal? You've got to change the way that you eat. You've got to seek out new foods. You've got to change, period. There will come a time, and it's happening to me, that you can eat more. And if you use the fact that, oh, I can only eat a little bit and don't change, when you start being able to eat more, I'm afraid you're going to be in trouble. So you need to listen to your plan. You need to follow their guidelines. Every plan is different. But learn to eat in a different way. My plan wants you to eat a protein and a non-starchy vegetable. Occasionally, instead of that non-starchy vegetable, eat a fruit. I am doing my best. Am I perfect? Absolutely not. But if you start out with the mindset, gosh, I can eat anything I want just in a smaller amount, I'm afraid you may be initially successful, but you're going to have regain at some point when that stomach starts tolerating more and you're eating pasta Alfredo, it's going to go right through. Another thing that you really have to be mindful of is slider foods. Those are those high carbohydrate foods like potato chips, popcorn, pasta, breads, rice that don't have any substance and have very little nutritional value and just slide right through your pouch. You can eat a lot of those without getting full. And if you get into that slippery slope, it's a scary place to be. So just remember, your surgery is a tool. It will help you, but it's not going to do the work for you. You have to be willing to change. That's the reality. Another thing that I have learned is your taste changes. Try new things. Try things that you used to not like. For example, I have never liked cabbage. I am not a picky eater, but cabbage was a no for me. I have discovered that I like cabbage. I have tried cabbage in a lot of recipes. I have tried cabbage, chopped cabbage in different salads, and I actually enjoy it now. And it's such a good food for you. So try something different. Try it with an open mind. Don't think, well, I've tried that before and I don't like it. Try it again. Try it with an open mind. Don't go in with preconceived notions that you're not going to like it or that you don't like it or that it's gross or it's a healthy food. Just try it and see. When you have weight loss surgery, your stomach is extremely valuable real estate. Hopefully, you're not going to buy $1 million little property and put a tent on it or put a shack on it. You're going to put something worthy of that space. Think of your food in the same way. Don't fill it full of junk, of trash. Make sure that you get the highest quality nutrients that you can, the best quality food that you can, because you can't eat very much of it. That is true. That amount goes up, but you have to think of your weight loss surgery tool as the most valuable asset that you've got. And you have to be very selective. So that's something I have learned. Another thing that I have really learned is how important for me, everybody is different, but for me, tracking and weighing my food is. If you don't track, you don't know truly what you're getting. You may be getting less than you think you are. You may be thinking that you are putting all the good nutrients that you are eating to your plan's guidelines, but unless you have concrete proof of that, now that doesn't mean you have to go to restaurants with a scale. That doesn't mean you have to measure everything. But most of the time, if you do it, I think you will come out on the winning end of that. I use Lose It Tracker. It's a free tracker, although there is a paid version, which I do subscribe to, that really helps me get a picture of what is going on with my intake. Another thing that I do, and I'm going to insert a picture of it here, this is kind of old school. I wrote out in a notebook the most fundamental requirements of my plan. They are, for me, again, every plan is different, 64 ounces or more of water a day, 80 grams or more of protein a day, no more than 2 fats per day, less than or equal to 30 grams of carbohydrates from non-starchy vegetable sources. So, all those good vegetables that you eat, they don't count in my plan against your carbohydrates. That 30 grams is for fruit, for any kind of starches that you choose to eat, condiments, sauces, things like that. Those count towards that 30 grams. And then my plan recommends to eat 3 to 4 hours a day. The fats, those are things that contain more fat than they do anything else in my plan. For example, nut butter, nuts. I was just looking at the nutrition on almonds. Over 15 grams of fat per serving. And they do have some carbohydrates. They do have a little bit of protein, but fat is the biggest thing. So in my program, that counts as a fat. Mayonnaise, full fat salad dressing, those type of things. Bacon, because bacon has more fat than protein, count as a fat in my plan. You can have them, but just limit them to two servings a day according to my plan. I'm sure your plan gave you something similar. So that, having my little notebook where I write that down and I put a little check mark by what I hit at the end of the day. I look at my tracker. You got to track to be able to do that, to see where you're at. I put a check mark. If I miss it, I put a little X. At the end of the week, I go back and say, okay, I've been doing pretty good. This is why the scale is moving. Or, I've been doing pretty good. The scale is not moving. Don't panic. You're doing what you need to. And then if you look back and you got a little more X's than you do check marks and the scale's not moving where you want it to, you probably need to rethink and try to get back on track with your plan. The other thing that I have learned especially the last month or two, right after you have weight loss surgery, your hunger is greatly diminished. It does start returning. So that's another thing where learning to eat in a completely different way is going to give you the support that you need. If you keep eating the same crap that got us where we were to the point that we needed to lose enough weight that we really needed weight loss surgery, when that hunger comes back and that restriction starts to naturally get less, you're gonna be going down a bad path. So know that hunger does return, that you are going to be able to eat more. This tool is a wonderful gift to help you get to a healthy weight quickly. After that honeymoon period, which is usually a year to 18 months, I'm still in it, but after that, it's on you. Have been given a gift to be able to learn new healthy habits to change your life. After that, it's you got to take over. For me, my plan recommends eating every 3 to 4 hours. As my hunger has returned, I have found that very reassuring. I am most likely not truly hungry. I am probably um, thinking about food, looking forward to my next meal. Having a plan and having a time that I know I'm going to be eating again kind of mentally reassures me, okay, don't panic. You're going to get something good soon. So that's kind of one thing that I have found that my plan recommendation of every 3 to 4 hours really helps with. The other thing that I have learned that is so important, and here again, I feel like most plans recommend this, is hydration. Don't drink your calories. Now, I have, as you have seen in my weekly videos, I do have an occasional glass of wine or cocktail, a very low carbohydrate cocktail like a martini or something like that. But I do know, I plan on that, I put that into my tracker. My body is going to burn those calories before it burns calories from my weight stores, from my fat stores. So don't drink your calories. That's really important. Um, Make sure you get plenty of fluid. I have found that getting in fluid helps decrease your hunger. It gives you satiety. It makes you feel fuller. So remember that. The other thing to remember in your weight loss post surgery journey is solid protein reduces hunger. You can eat something like a shake, which I have a shake almost every morning. It's because if I eat too early in the morning, I get kind of feeling. So I found that a shake works for me. But if I substitute a shake for another meal or I substitute a bar for another meal, I'm hungry again pretty quickly. Whereas if I ate chicken breast or beef or something like that in the same amount of protein, I'm not hungry for a while. Solid protein is the key for me. Um, the other thing that I recommend you do, get labs drawn right before you start this process. I just had labs done last week. I'm going for my 6 month follow up with my surgical team, and I had my physical with my healthcare provider last week, so I got labs on that. My labs are so good. I am so proud of them. I've never had terrible cholesterol, but it's down 40 points since the week before I started this journey. Uh, Nothing abnormal at all. Even in my ferritin, those iron stores, in kidney function, liver function, blood sugar, A1C. I've never had a problem there, but they were all great. So I encourage you right before you start, get labs to kind of have a before and after. Anyway, folks, like I said, I don't mean for any of this to be healthcare advice. That's not what it is. I'm not an expert in weight loss surgery. I am just a patient who has, through their job, been very fortunate to interact with a lot of other patients and have those people put their trust in me and confide in me about their journeys as well. I hope some of this information has helped you. Like I said, this is a longer video than normal, but 6 months, I'm just so thrilled at where I'm at. If you have any questions, please comment below and I'll be glad to help in any way I can. I hope everybody has a great week and plan on seeing my new weekly video on Wednesday. Bye.